This talk is intended for the neurophysiology fellows at Nicklaus Children's Hospital. It is important for clinical neurophysiologists to have a solid understanding of the anatomy and physiology of the auditory system. I will try to convey to you this information during this session. I will also, at the end, talk about acoustic reflex testing. I am doing this because of the great emphasis on anatomy that requires understanding this examination. There will be a separate talk about auditory brainstem evoked responses in the next few weeks. This talk will be conducted using a question and answer format. The purpose of the tensor tympani muscle and the stapedius muscle is the same: A true, B false. This is a representation of the ear. The shaded area constitutes the external ear. And as you can see, the three most important components are listed in this frame. They are the auricle, the external auditory canal, and the tympanic membrane. The shaded area in this frame constitutes the middle ear. Are listed in this frame. I like to call your attention to the fact that the stapes is attached to the oval window. In this frame, I have left only the ear bones and the tympanic membrane. I have done so to show you the attachment of the tensor tympani muscle to the malleus. This muscle is innervated by a branch of the trigeminal nerve. I recall this fact by matching the T's: tensor tympani trigeminal. And to show you the attachment of the stapedius muscle. This muscle is attached to the stapes bone and it is innervated by the 7th cranial nerve. The function of this muscle is to dampen sounds. This conclusion was confirmed in 1935 after an ingenious experiment involving cats and lots of gadgets, as you can see in this frame. These researchers first considered the significance of the two muscles acting physiologically and then drew the conclusion based on rigorous experimentation that indeed they both had a damping effect on sound vibrations. So the answer to this question is true. Next question. A potassium level of 150 millimoles is normally present in A. blood, B. CSF, C. perilymph, D. endolymph. I am going back to the same drawing of the ear that I showed you before. The area shaded in this projection is the inner ear. The most important structures are labeled in this frame. I'd like to call your attention to the cochlea. I have added in this frame a rectangle to indicate the level of the cut that I will represent in future frames. Here I have represented them in their original orientation, where in this frame I have represented the cochlea in an up-down position in order to make it easy for us to review it. The region on the top is called the apex. The region on the bottom is called the base. Another important structure in the cochlea is its central pillar that is called modulus. This structure is indicated by the arrow. This structure serves as the trunk for the branches, the first branches being the spiral lamina that itself branches out into the vestibular membrane and the spiral ligament. Please notice in this frame their location. If we go back to the branches, we can see that they divide the external region of the cochlea in three compartments. The vestibular ramp or duct, the tympanic ramp or duct, and the cochlear ramp or duct. The vestibular ramp is connected at the end to the oval window. The tympanic ramp is connected at the end to the round window. The vestibular and the tympanic ramps or ducts are connected with each other at the apex and have a fluid inside that is called perilymph. The cochlea ramp or duct has a liquid inside too. This liquid is called endolymph. The composition of the peri and endolymph is different. Sodium is 140 in the perilymph and only 1 in the endolymph. Potassium is 4 to 5 in the perilymph and 150 in the endolymph. The potential in the perilymph is 0 and the potential in the endolymph is plus 80 or positive 80. So the answer to this question is D. Next question. The basilar membrane rests on the A. Vestibular membrane, B. Spiral lamina, C. Spiral ligament, D. None of the above. The cochlea, as we have mentioned, has a vestibular ramp which is connected with the oval window. The stapes rest on the oval window by its base or footplate. So when the stapes moves, a wave is created in the vestibular ramp that travels through it, and at the level of the apex is transferred because of its continuity with the tympanic ramp. This movement causes displacement of the round window, and in addition it also causes movement of the basilar membrane that, as you know, rests on the spiral ligament. So the answer to this question is C. Next question. High frequency tones are detected at the apex of the cochlea. A true, B false. The basilar membrane is a very important hearing element. As you can see in this frame, I have superimposed a three-dimensional representation of the basilar membrane in the cochlear structure that you had seen in the past. I have done so in order to present to you, which I have done in this frame, the basilar membrane on its own. And now I have made reference to a linear representation of the same membrane, although much shorter than it is represented in the spiral form. I have done this in order to better talk about the tonotopic sound representation of the basilar membrane. In this frame, I have introduced the representation of a piano with musical notes. At the bottom, indicated by the arrow, you can see low frequency notes, and at the top you can see high frequency sounds. Now, if we look at the basilar membrane, we can see that high frequency sounds are represented at the bottom and low frequency sounds are represented at the top. I will now reintroduce the diagram of the cochlea that I had shown you before to say a few more things about the basilar membrane. The untwisted basilar membrane measures about 31.5 millimeters. It is a thin structure which is thinner and stiffer at the base and broader and floppier at the apex. Those high-frequency sounds are triggered by motion of the basilar membrane at the base of the cochlea, and low-frequency sounds are triggered by motion of the basilar membrane at the apex of the cochlea. In this frame, I have given numerical values to the different sites of the different frequencies in the basilar membrane. This is called tonographic organization or tonotopical organization. The human ear has the lowest threshold to sound using clicks with a frequency band of 2 to 5 kilohertz. This frequency produces a band that causes maximal vibration somewhere in the middle region of the basilar membrane, but also extends to both sides as it is depicted by the undulating magenta line in this frame. It happens that wave 5 of the brainstem evoked auditory response is generated by vibration with a frequency in the 1 to 4 kilohertz, and wave 1 is triggered by vibrations in the frequency of 4 to 8 kilohertz. So when we stimulate with 2 to 5 kilohertz, we produce what we call a broadband stimulation, since most of the basilar membrane, all the way from the apex to the base, gets stimulated, although not at the same strength. So the answer to this question is false. Next question. The neurons forming cranial nerve 8 are called A, the spiral cochlear ganglion, the auditory ganglion, the otic ganglion, D, none of the above. This is a representation of the cochlea which I have shown you before. The arrow is pointing to a spinal ganglion cell that, as you can see, are in a promontory structure of the inner cochlea. This promontory structure is located in the middle of the cochlea and is forming the spiral cochlear ganglion. The arrow in this MRI shows its configuration, which can be better appreciated in this enlargement. Arising from this promontory structure are the axons that I have added in this figure as blue lines, which I have signaled in this MRI by the magenta arrow. So the answer to this question is A. B. Cranial nerve 8 contains purely afferent fibers. A true, B false. We're looking again at this representation of the cochlea, and you can look at the area inside the blue box. I have removed the endolymph and perilymph, so we're left with an organ. This is the organ of Corti. As you can see, it is resting primarily in the spiral ligament. We can also appreciate the spiral lamina and the vestibular membrane. In this new frame, I have only left the basilar membrane. I have done so to enlarge it, as you can see in this frame. As I previously mentioned, the organ that is resting on the lamina is called the organ of Corti. This organ is also called the spiral organ. It is important to recognize that vibration of the basilar membrane occurred in an up and down fashion. This is due to movement of the tympanic membrane. Nevertheless, the same type of flow or vibrations that causes up and down movement of the basilar membrane produce at the level of the tentorial membrane a movement that goes from back to front and from front to back. Another important structure that we can see in this frame is the outer hair cells indicated by the arrow, which, as you can see, I have drawn 3 of them. They are part of the organ of Corti. And we can also see the inner cells, which I have also pointed by an arrow in this frame. These cells are separated by a tunnel that is called the tunnel of Corti. This tunnel is flanked by the inner rods of Corti and the outer rod of Corti. On the superior surface of the inner cells, we find Stereocilia. This Stereocilia is in contact with the tentorium. The Stereocilia I have just shown you at this point are those Stereocilia that belong to the inner hair cell. The outer hair cells also have Stereocilia. The next structure I would like to call your attention is the spiral ganglion cells and its dendrite. These dendrites carry information towards the spiral neuron, so they are efferent fibers. In addition to these efferent fibers, there are also efferent fibers that probably arise from the brainstem. I have represented these efferent nerve fibers in red. They, as represented in this frame, make contact with the hair cells. So the answer to this question is false. Next question. Movement of the stereocilia is the first step in the process of triggering an action potential in the spiral ganglion cells. A true, B false. Hair cells in the cochlea are distributed in the organ of Corti, inner hair cells, and outer hair cells. They, as it is obvious by their name, have little hairs at the uppermost end. This hair, as we mentioned before, is called Stereocilia. Below these cilia, there are channels, here represented as red dots, that when open due to movement of the hairs on top of them, allow positive ions to enter the cell. These ions accumulate on the opposite end of the hair cells and create a receptor potential that ultimately creates a dendritic potential that travels through the dendrite and ultimately produces an action potential starting at the axon hillock of the spiral cell. So the answer to this question is true. Next question. Probst's commissure connects the A. Ventral cochlear nuclei, D. Dorsal ventral nuclei, C. Superior olivary complexes, D. Nucleus of the lateral meniscus. This diagram shows the auditory apparatus. In this new frame, I have represented the organ of Corti as I have presented it to you before. The hair cells, here indicated by the arrow, which I told you they were called Stereocilia. In this case, outer Stereocilia. The outer Stereocilia reacts to movement of the basal membrane as well as the inner Stereocilia. Dendrites I have indicated here by the arrow in the general diagram, and here in the representation of the organ of Corti. I have introduced the cochlea in this frame to indicate and give you a better perspective of the location of the dendrites. The dendrites lead to the spiral ganglion cells, which I have indicated here in the general diagram and here in the diagram of the cochlea. The intracochlear nerve which are the axons arising from the spiral neurons, which I have represented in blue, are now indicated in the general diagram and in the cochlea diagram. Now I will introduce the temporal bone, which I have indicated here in the general diagram and here in the ear diagram. The temporal bone has inside the intertemporal cochlear nerve, which I am indicated here in the general diagram and here in the ear diagram. This nerve enters inside the skull by what is called the internal auditory meatus. So it will correspond to this area in the general diagram, and if we look at the skull in a view from on top, you can see where I have placed the arrow, which is where the facial nerve as well as the vestibulocochlear nerve come out. This is called the internal auditory meatus. Once inside, we begin to see the intracranial portion of the cochlear nerve. I have indicated it here in the general diagram and here in the intra-skull diagram. I have now introduced a block specimen of the brainstem to show you the location of the intracranial portion of the cochlear nerve. This new block specimen I have introduced for the same purpose, so you can see the intracranial portion of the cochlear nerve. This MRI, which I have introduced in this frame, is also there for the same purpose, so you can see how the intracranial portion of the cochlear nerve looks when it is viewed by resonant imaging. Going inside the brainstem parenchyma, we now need to recognize the ventral cochlear nucleus. Here I have pointed to the ventral cochlear nucleus in the general diagram, and here I have introduced a histological specimen in order to point out to you the location of the ventral cochlear nucleus. As you can see, the arrow points to it. It is important to remember that the ventral cochlear nucleus, as well as the dorsal cochlear nucleus, which I will mention in a moment, is made of bipolar cells. In addition to the ventral nucleus, which I pointed out to you a few seconds ago, we also have to consider the dorsal nucleus, which, as I mentioned, also has bipolar cells. I have indicated the location of the dorsal cochlear nucleus by the arrow in the histological specimen. Following, we look at the trapezoid body, which is indicated here in the upper medulla ventrally and dorsally. This trapezoid body extends upwards up to the lower pons, upper pons, and lower midbrain as indicated by the arrows. You can see now that I have introduced a block specimen representing the brain and the brainstem. In this specimen, I have indicated the location of the trapezoid body that can clearly be seen. I have now introduced a histological specimen for the same purpose. You can see in it the trapezoid body. And also you can see it at the level of the mid-pons. Another structure in the acoustic pathways are the nucleus of the trapezoid body, that they are in the region at which the fibers from the trapezoid body take an upward turn and become the fibers of the lateral meniscus. In this frame, I have pointed with the arrow where the nucleus of the trapezoid body is. And in this new frame, the lateral meniscus. The lateral meniscus continues going up, and I have now introduced in this frame the block specimen of the brain and brainstem in order to show you where this structure is at. You can see that the lateral meniscus is here represented and pointed by the arrow. As you can see, it is a very prominent structure that can easily be dissected and studied. Continuing up, we go to the superior olivary complex. I have pointed them here in the general diagram. The superior olivary complex is an important structure because it seems to be able to localize noise, although in human it cannot do so unless the cortex is functional. In addition, some fibers from this nuclei send efferent fibers to the hair cells in the cochlea. I hope you remember those that I drew in red as red lines going towards the hair cells. Those are the fibers that arise from the superior olivary complex. I have now introduced a histological specimen at the level of the pons in order to show you the location of the superior olivary nucleus. Here the arrow points to it. The olivary nucleus is flanked by the lateral meniscus, which continues on its way up and can easily be seen even at this level when we look at the block specimen of the brain and the brainstem. Here again I am pointing to it. Somewhere between the middle of the pons and the lower midbrain, we find some nuclei. These are called the nuclei of the lateral meniscus. Here I am pointing to them in the general diagram, and I'm pointing here at the specimen that is at the block brainstem specimen at the location where they are likely to be, although we cannot see them in this specimen. There is a commissure that goes between these structures, and it is called the props commissure. This structure is called a commissure because it connects both lateral meniscus nuclei, and I guess because it was discovered by Dr. Probst. The acoustic fibers continue in the lateral meniscus and, as being pointed by this arrow, reach the lower midbrain. In this frame I have included a histological specimen of the lower midbrain. The arrow is pointing to the lateral meniscus fibers arriving at the inferior colliculus. The inferior colliculus is, as I previously mentioned, at the lower midbrain. Here I have placed arrows in the general diagram so you can see them. And in this histological specimen, I have also used the arrow to point them out to you. In this block specimen of the brain and the brainstem, you can clearly see the inferior colliculi. Both colliculi are connected through a commissure, which is called the commissure of the inferior colliculi, which I am pointing to you in the general figure, and also pointing to you the location in the block specimen, although we cannot see it in this specimen. So the answer to this question is D. Next question. Tonotopic organization only exists at the cortex. A true, B false. The brachium of the inferior colliculus is indicated in this frame. Now I have introduced the block specimen of the brain and brainstem in order to point out its location. I have also introduced a histological specimen for the same purpose. Here, pointed by the arrow, is the brachium of the inferior colliculus. The brachium of the inferior colliculus connects it with the medial geniculate ganglion of the thalamus. In this specimen, you can see its location. That is the location of the medial geniculate ganglion. And in this other specimen, which is a histological specimen, you can also see it. I have now in the general diagram signaled the acoustic radiations. The acoustic radiations can also be seen in the block dissection specimen of the brain and the brainstem, here indicated by the arrow. This structure leads to the acoustic cortex in the transverse temporal gyrus. The acoustic cortex, here indicated by the arrow, corresponds to the top of the roof of the temporal lobe, which is normally covered by the parietal operculum. This area has been named Area 41 of Brodmann. In this area, according to some, the high frequency tones are represented medially and the low frequency tones are represented laterally. Whereas according to other authors, the distribution is a little bit different, with the low frequency tones being displaced anteriorly and the low frequency tone being represented posteriorly. But all authors are in agreement that there is a tonotopic organization at the level of the cortex. This tonotopic organization is also present at the level of the medulla, where the activity, or that is the sound with high frequency, that is about 20 kHz, is represented in the back part or in the dorsal part, whereas the lower frequency sounds are represented in the more anterior part, that is in the ventral part. At the level of the low midbrain, tonotopic organization is also present, but the fibers are in the opposite direction. Those that carry high frequency information are ventral, and those that carry low frequency information are dorsal. So the answer to this question is false. Next question. The cochlea is irrigated from the A. superior cerebellar artery, B. anterior inferior cerebellar artery, C. posterior inferior cerebellar artery, D. posterior communicating artery. This is a representation of the brainstem circulation with the names of the arteries listed. As you can see, the irrigation of the cochlea is mostly achieved by the anterior inferior cerebellar artery by way of the labyrinthine artery and the common cochlear artery. Injury to the anterior inferior cerebellar artery produces different symptoms depending on the location of the injury. If the injury is proximal, the lateral pons and the cochlea will be involved, whereas if the lesion is distal, only the cochlea will be involved. So the answer to this question is B. Next question. The superior olivary complex is the hub for the acoustic reflex. A true, B false. Early in this talk, I show you a figure, which is the same figure that I am showing you now. I show you that figure to indicate that the stapedius muscle was innervated by the 7th cranial nerve and the tensor tympani was innervated by the 5th cranial nerve. And also to point out that their contraction has a damping effect on sound. Also earlier on, I introduced this figure that, as you can see, is from a journal that was published in 1935. This figure was presented in that article to show the method that was used to validate the damping effect of the contraction of these muscles and that they had a protective mechanism against loud noises. More recent studies suggest that the effect of contraction of the stapedius muscle and the tensor tympani muscle have a damping effect on sound, but it is not used for protection from loud noises coming from outside, but it is to decrease the sound of our voices when we talk. Be it as it may, our interest in neurology regards localization. This figure has the most important acoustic structures involved in the acoustic reflex. Only the left cranial nerve 8 with its brainstem connections is represented here. I have labeled the superior olivary complex because of its importance in this reflex. I have now introduced to this frame the right external and middle ear. Now I introduce the muscles in question and their respective innervations. In this frame I have added the connections between the superior olivary complex and the ipsilateral and contralateral motor nuclei of the 5th and 7th cranial nerves in charge of innervating the tensor tympani and the stapedius muscles. The reason that this acoustic reflex is sometimes referred to as the stapedius reflex is because the contraction of the stapedius muscle appears to have a more powerful effect than the contraction of the tensor tympani when it comes to reducing the intensity of sound. Be it called acoustic or stapedius reflex, the structure that appears to have or to be in the center of this reflex is the superior olivary complex. So the answer to this question is true. Next and last question. Which of the following lesions can be supported based on findings in the acoustic test reflex? A. Cranial nerve 7. B. Cranial nerve 8. C. Mid-pontine lesion. D. All of the above. Interpretation of the acoustic reflex in a patient with normal hearing depends on establishing the presence of bilateral tympanic contraction as depicted in this frame, or the lack of bilateral or unilateral contraction with unilateral ear stimulation. In the top row, the right and left indicate the right and left ear. That is the ear that is being stimulated in the different trials. On the side, I am representing the contraction of the right and left tympanic membrane. The plus sign indicates the presence, that is the presence of tympanic contraction, and the minus sign indicate their absence. The location of the problem, that is the location of the central nervous system damage or peripheral nervous system damage, is presented in the row indicated by the green arrow. If we stimulate the right ear and we find contraction of the right and the left tympanic membrane, and then we stimulate the left ear and we find contraction of the right and the left tympanic membrane, then the study is normal. If, on the other hand, we stimulate the right ear and we find that there's no contraction of the right tympanic membrane, but the left tympanic membrane contracts, then we stimulate the left ear and find that there's no contraction of the right tympanic membrane. The abnormality is present in the right 7th cranial nerve. If, on the other hand, we stimulate the right ear and we find that there's no tympanic contraction in the right and in the left, and then we stimulate the left ear and we find that there is contraction in the right and the left tympanic membrane, we know that the problem is in the right 8th nerve. If, on the other hand, we stimulate the right ear and we find that there's no contraction on the left, but there is contraction on the right, and then we stimulate the left ear and we find that there is contraction on the left, but not on the right tympanic membrane, then the lesion is at the level of the mid-pons. So the answer to this question is D. Thank you very much for your attention.